Hi, my name is Michael Keene, and I'm a physical therapist assistant student from Carroll Community College. When I'm chewing gum, I choose trigeminal gum. What better way to represent my favorite cranial nerve, Cranial Nerve V?
Oh, Mike. Let's review the anatomy of the cranial nerve 5.
I'm going to review the anatomy and function of the trigeminal nerve. It is the largest of the 12 cranial nerves. The trigeminal nerve transmits sensory info to the skin, sinuses, and mucous membranes of the face. It also stimulates movement in the jaw muscles.
So Wendy, how many parts does the trigeminal nerve have?
Mike, I'm so glad you asked. It has 3 divisions: an ophthalmic, a maxillary, and a mandibular. The first division, the ophthalmic, transmits sensory information. It innervates the scalp, forehead, upper eyelids, cornea of the eye, the bridge of the nose. The next division, the maxillary division, transmits sensory information also. It innervates the lower eyelid, the cheeks, upper lip, the roof of the mouth. The third and final division is the mandibular, and it transmits sensory as well as motor information. It innervates the outer ear, the lower mouth, the lower lip, the chin. It also controls movement of the muscles in the jaw and some within the inner ear.
How do I know if there's something wrong with my trigeminal nerve?
Well, Mike, you'd have a loss of sensation or shooting facial pain. You could have trigeminal neuralgia, which is a sharp pain of at least one branch of the nerve. It's usually short, excruciating pain, usually unilateral, and triggered by temperature change, a blast of air, chewing, or stress.
Mike!
You could also have paresthesia or paralysis of mastication muscles. You could have locked jaw, or you could have impaired hearing.
What?
Go ahead.
Okay, Mike, since you're so curious about the trigeminal nerve, let's test it out and see if yours is working properly.
Okay.
Okay, is that all right with you? I'm
That's
going to
fine.
take this Q-tip and I'm going to touch some areas of your face. I would like you to close your eyes and tell me if you can feel this.
Yes. Yes.
All right, I'm touching both sides one at a time. Yes?
Yes.
So that we can make sure
Yes.
that both sides are working.
Yes. Yes.
I touched his forehead, his cheeks, and his chin.
Okay, Mike, next we're going to test your sharp versus dull sensations in your face. So we're going to do the same test with Wendy, except this time I'm going to use a pinprick. So go ahead and close your eyes, and I want you to tell me if it's dull or sharp.
Sharp.
Keep those eyes closed.
Dull. Dull. Sharp. Dull. Sharp.
Okay, Mike, next we're going to test your corneal reflex. So I'm going to take this cotton swab and poke you in the eye with it. Just gently, okay?
Okay.
So when I do this, I want you to look up as I approach. Okay, and let me test your other side. Okay.
All right, Mike, I'm going to check the motor function of your trigeminal nerve. That means I'm going to test your muscles. So the first thing I'm going to do is put my hands under your jaw, and I want you to try to open your mouth against me. Okay, I can feel the muscles working there. That part's working. Now I'm going to press my hand here, and I want you to try to move your jaw to the side where my hand is. Okay, good. Now again, the same way. All right, it's working both. And I want you to clench your jaws, and I'm going to feel for those muscles to contract. Great job. You have some nice muscles there, Mike. What kind of gum do you chew?
Why, I chew trigeminal gum. Warning, trigeminal nerve injury can be caused by stroke, facial injuries, brain tumor, neurological conditions like MS, Bell's palsy, trigeminal neuralgia, cluster headache, and Wallenberg syndrome. Sponsored by Trigeminal Gum.